Sup, chooms, how y'all living? Hope everything is Nova and you're all having a preem week. So, one of the most common questions in the comments is whether finasteride or dutasteride can cause fatty liver and insulin resistance that leads to diabetes. I've actually talked about the effects of these drugs on the liver before, specifically in this video that I'll link below. More recently, I covered the subject again in my DHT is a trash hormone part 8 video where I responded to Team 3D Alpha, you guys remember him? But that was over a year ago, and there's actually been some new research on this subject that has come out since that video was made. Also, recently, I've noticed that a lot of anti-finasteride trolls on hair loss communities like Trestless have been saying that these drugs definitely cause fatty liver and diabetes, and so now a whole bunch of people are afraid to take 5-AR inhibitors, which means that I am now left with no choice but to use my Witcher skills to make some sense out of all of this mess, or else some innocent people will definitely fall victim to the slaphead curse, and I can't let that happen. So, there is definitely a lot of confusion on this subject, but I think this video will hopefully make clear what the truth is about whether or not finasteride and dutasteride can cause fatty liver and diabetes. So, let's go ahead and oil our blades, drink our potions, and prepare our bombs, because it is time for some hair loss witchery yet again. Okay. So first of all, what's the theory behind all this? What is fatty liver, and what does it have to do with insulin resistance and diabetes? Fatty liver is the commonly used term for non-alcoholic fatty liver disease, or NAFLD. For the rest of this video, I'll go ahead and just call it fatty liver to keep things simple. There is another kind of fatty liver that you get from drinking alcohol, but I won't be talking about that because it isn't germane to what we're discussing here. What we're talking about today is non-alcoholic fatty liver disease. This disease is defined as having more than 5% fat in the liver of people who do not drink a significant amount of alcohol. Fatty liver is already very common, and it is unfortunately becoming more and more common, especially in the United States, where some estimates of the prevalence of fatty liver are as high as almost 50%. That's because one of the causes of fatty liver is obesity, and since the obesity rate is so high in the United States, the rate of fatty liver is also very high too. Unfortunately, all around the world, the prevalence of non-alcoholic fatty liver is rising rapidly due to many factors like obesity, sedentary lifestyle, and poor diets. Whenever you hear about fatty liver, you almost always hear about insulin resistance too, as well as type 2 diabetes. So why are they linked together? Well, the details are very technical and aren't too important, but I'll just go ahead and summarize what happens briefly. Fat in the liver breaks down into a molecule called diglyceride, or DAG. DAG activates a specific protein that binds with the insulin receptors and deactivates them. This makes insulin less effective, and since insulin lowers blood sugar, the result is that blood sugar levels rise and you get type 2 diabetes. So, the next question is, what in the world would finasteride or dutasteride have to do with any of this? I mean, we're talking about a drug that is used to treat hair loss and enlarged prostate, chooms, so how does that have anything to do with what we're talking about here today? Well, as you chooms know, finasteride and dutasteride block the 5-AR enzyme that converts testosterone into the trash hormone DHT. So, you might be thinking, does lowering the trash hormone DHT cause fatty liver? Well, no, it doesn't. As we'll see at the end of this video, lowering DHT might actually help prevent fatty liver. The reason people claim that 5-AR blockers can cause fatty liver is because the 5-AR enzyme has other effects besides just converting testosterone into DHT. This is something that neckbeards on hair loss communities will usually bring up when they're trying to sound smart and they're debating people. They'll claim that finasteride and dutasteride have neurological side effects because the 5-AR enzyme doesn't just affect DHT levels. They'll say things like, "But Kevin, the 5-AR enzyme is necessary for neurosteroids. So if you block the 5-AR enzyme, you'll get brain fog or depression, or even worse." So, what these people are talking about is the synthesis of a hormone called allopregnanolone. Allopregnanolone is what inevitably gets brought up in every argument with a finasteride hater. They think it is some sort of rhetorical kryptonite they can use to defeat anyone in an argument who is pro-finasteride. So for the very few people who do not know what I'm talking about, the 5-AR enzyme converts progesterone into 5-alpha dehydroprogesterone, which is the precursor to allopregnanolone, which is a neurosteroid. But what anti-finasteride trolls always neglect to mention is that this conversion happens in the brain, and it is done by the type 1 5-AR isoenzyme. Finasteride doesn't affect the type 1 isoenzyme, so it doesn't have any effect on this process. In the case of dutasteride, it actually does inhibit the type 1 isoenzyme, but it does so much more weakly than it affects the type 2 isoenzyme. It's about 14 times stronger at inhibiting the type 2 isoenzyme than the type 1 isoenzyme. But Even though dutasteride does suppress the type 1 isoenzyme somewhat, it doesn't have any neurological side effects either. The reason why is because of the size of the dutasteride molecule. The size of the dutasteride molecule is 528 Daltons. That means that it does not cross the blood-brain barrier. So all this fear-mongering you hear about 5-AR inhibitors causing depression, brain fog, or suicidal ideation is all completely bogus. The people who claim they have neurological side effects are either having a nocebo effect or their problems are caused by other factors besides 5-AR inhibitors. They just refuse to acknowledge it though because they've been brainwashed by anti-finasteride propaganda. The bottom line here, chooms, is that neither drug has ever been proven to cause neurological side effects. Never. And if you want more data about this, I'll go ahead and post my entire My Neurosteroids playlist below where I go over literally every single piece of research that has ever been done on this subject. But besides affecting the conversion of progesterone into 5-alpha dehydroprogesterone, there's yet another role for the 5-AR enzyme that some people claim could link it to the development of fatty liver. There is a possibility that 5-AR blockers could affect the metabolism of the hormone cortisol. Cortisol is synthesized in the adrenal glands, and it is a major anti-inflammatory hormone that is triggered by stress. Cortisol has benefits over the short term, so it's not exactly a trash hormone like DHT, but if cortisol levels are elevated over the long term, it actually is sort of a trash hormone because it causes a lot of medical problems. People who have tumors that cause elevated cortisol levels or people who take cortisone chronically for treating autoimmune diseases develop a lot of problems, including obesity. One of the bad things that high cortisol levels cause is fatty liver. So you're probably asking, but Kevin, what does this have to do with finasteride and dutasteride? Why don't you stay on point, bro? Well, it turns out that the 5-AR enzyme is involved with the metabolism of cortisol. You can see this in this diagram here. It shows that cortisol can be broken down by several pathways. One of those pathways is through the 5-alpha reductase enzyme, but it can also be broken down by the 5-beta reductase enzyme as well. So if the 5-AR enzyme is blocked, theoretically, cortisol levels could rise, and indirectly, that could lead to fatty liver. But what actually seems to happen is that in people on 5-AR blockers, less cortisol is metabolized by the 5-AR enzyme, but more of it is metabolized by the 5-beta reductase enzyme so that serum cortisol levels stay normal overall. This was documented in a study that we'll be discussing in more detail later in this video. So, if serum cortisol levels don't change with finasteride or dutasteride, why would they cause fatty liver, you may wonder? Good question, chums. Theoretically, it is possible that in certain tissues like the liver, cortisol levels could rise locally and cause fatty liver, even if serum cortisol levels don't change. So that's enough theory. Let's get beyond the theory and get into the actual research studies. So what studies are out there that either prove or disprove that 5-AR blockers could cause a fatty liver? Well, there are actually two types of studies that have claimed that 5-AR blockers cause fatty liver and insulin resistance. As usual, we're talking first about rodent studies here, chums, but we also have some human studies as well. And as I'll soon show you, we're going to see how the rodent studies don't apply to humans, and they give conflicting results as well. Also, the human studies are very flawed too, as we'll soon see. So first, let's go ahead and take a look at the animal studies. The first study was done on mice and rats. The mice were genetically modified so that the type 1 5-AR isoenzyme was absent. Normally, the type 1 5-AR isoenzyme is present in the liver, but these mice had no type 1 isoenzyme activity at all. These mice were then fed a high-fat diet and were compared to normal mice who were also fed a high-fat diet. The mice who lacked the type 1 5-AR isoenzyme gained more weight on the high-fat diet than the normal mice did. They also had high blood sugar and showed signs of insulin resistance. They also developed fatty liver. In this figure here, TAG stands for triglycerides. That's TAG TAG, which just means fat. The investigators found that this effect occurred even in castrated mice. So the fatty liver had nothing to do with the lack of conversion of testosterone into DHT. So the authors then proposed that the fatty liver occurred because of accumulations of corticosteroids like cortisol due to the lack of the type 1 5-AR isoenzyme that metabolizes those steroids. The second part of the study was done in rats who were given a daily dose of finasteride at 0.35 milligrams per kilogram per day. So this part of the study showed that finasteride plus a high-fat diet also caused an increase in liver and insulin resistance, much like what was seen in the mice lacking the type 1 5-AR isoenzyme. However, as the authors themselves point out, finasteride in rats is a strong blocker of both the type 1 and type 2 5-AR isoenzymes, unlike in humans where it only affects the type 2 5-AR isoenzyme to any degree of significance. So, as is usually the case in finasteride studies done on rodents, it is impossible to extend the results to human beings. But of course, that hasn't stopped the PFS conspiracy theorists from trying to do just that. So, let's take a look at another rodent study on the role of 5-AR enzymes in causing insulin resistance and a fatty liver. It's a similar study to the first study. The study first looked at the differences between the 5-AR isoenzymes that were present in a human liver versus a rodent liver. The study found that both the type 1 and type 2 5-AR isoenzymes were present in human liver, while only the type 1 isoenzyme was present in rodent liver. So that's another very important interspecies difference right there that makes it difficult to apply the results of rat studies to human beings. Anyways, in the study, the investigators developed genetically modified strains of mice that lacked either the type 1 or the type 2 5-AR isoenzymes. The mice were fed the ALIOS diet, which literally stands for the American Lifestyle-Induced Obesity Syndrome diet. I mean, our diet here in the USA is so bad that there is a mouse diet named after it that is designed to make mice fat. That's kind of sad and funny at the same time. It's basically what the authors consider to be a typical American fast food center diet with a high amount of trans fat plus supplementary high fructose corn syrup. So this study was done in 2013, and fortunately, trans fat has been banned in the United States since 2018. So our diet isn't quite so bad as what these mice had to eat, although it's still pretty damn bad, let's be honest. It's also known that if you feed mice this diet, they inevitably get NASH, which stands for non-alcoholic steatohepatitis, which is a severe form of non-alcoholic fatty liver disease. So basically, just like in the first study, the mice lacking the type 1 5-AR isoenzyme developed fatty livers and insulin resistance. Mice lacking the type 2 5-AR isoenzyme didn't have any more tendency to develop fatty liver than normal mice. This was probably because mice don't have the type 2 isoenzyme in their livers, and that the type 2 isoenzyme doesn't have anything to do with developing a fatty liver or diabetes. So even though the human liver does contain the type 2 5-AR isoenzyme as well as the type 1 isoenzyme, this study does seem to show that finasteride, which is a selective type 2 isoenzyme blocker, would probably be less likely to cause a fatty liver than dutasteride, which blocks both isoenzymes. But again, this is just a rodent study we're talking about here, chums. And so we need to look at what the human studies showed, because like I already said, the 5-AR isoenzymes are very different in human livers versus rodent livers, and a drug like finasteride works differently in humans versus rodents. So let's go ahead and take a look at the human data. The first human study is this one right here titled, quote, Changes of Metabolic Profile in Men Treated for Androgenetic Alopecia with 1 milligram of finasteride, unquote. That whole androgenetic thing always throws me off. I'm used to saying androgenic alopecia. Anyways, this is an extremely small study of just 12 men who were treated with 1 milligram of finasteride per day for androgenic alopecia. Blood tests were done at baseline and then every 4 months. As expected, DHT levels went down and total testosterone and free testosterone levels went up on finasteride at 1 milligram per day. Serum hormone binding globulin, or SHBG, initially went up but then came back down again. But unlike what occurred in the rodent studies, finasteride actually reduced insulin resistance and improved glucose levels, meaning finasteride had the potential to improve or reverse diabetes. The hemoglobin A1C levels, which is a marker of diabetes, actually went down with finasteride, which is what drugs designed to treat diabetes do. So this study is a big win for finasteride and a huge L for DHT cells. Of course, this was a small study, but if anything, it definitely contradicted the animal studies that predicted diabetes would get worse with a 5-AR blocker. So next up, we have this study here. This was a slightly bigger study enrolling 46 men with benign prostatic hyperplasia, BPH, and the men were randomized to receive either dutasteride at 0.5 milligrams per day, finasteride at 5 milligrams per day, or tamsulosin at 0.4 milligrams per day. Tamsulosin, for those who don't know, it is an alpha blocking drug that is used to treat benign prostatic hyperplasia, but it is not a 5-AR blocker like finasteride or dutasteride. It works completely differently. The men were treated for 3 months and various tests were done before and after treatment. First of all, like I already pointed out, this study showed that neither finasteride or dutasteride changed the cortisol levels in the serum or even in the saliva. So blocking the 5-AR enzyme doesn't actually raise cortisol levels. The other pathways that metabolize cortisol take over and keep the cortisol levels constant. The study found a slight increase in body fat on dutasteride of only 1.6%, but this change was not statistically significant. No change in body fat was seen with finasteride or tamsulosin. Dutasteride also impaired the response to high-dose insulin, while finasteride and tamsulosin had no effect. However, the insulin resistance in this study had nothing to do with the effect of dutasteride in the liver. Instead, the investigators found that the effect was probably due to the effects of dutasteride on adipose tissue, which contains the type 1 5-AR isoenzyme, but not the type 2 isoenzyme. So, this study concluded that any effect of dutasteride on insulin resistance was actually due to the effects of adipose tissue and not on the liver. Alright, so this study suggested that perhaps dutasteride could cause insulin resistance in fat cells, but hold on just a moment, chums. There's more data coming. Here's the next study. So this is another very small study with, again, just 12 subjects. The subjects were given either finasteride at 5 milligrams per day or dutasteride at 0.5 milligrams per day and had a metabolic evaluation before and after 3 weeks of treatment. In this study, dutasteride, but not finasteride, caused fatty liver and insulin resistance in the liver, but did not affect insulin resistance in the adipose tissue. So remember that the study that I just showed you found the exact opposite results. It found no effect on insulin resistance in the liver, but it did find insulin resistance in adipose tissue. But again, this was a very small and very short-term study, and it's definitely possible that the results were related to just chance alone, especially since the study groups were not really equivalent. There were baseline differences in BMI and in liver lipid levels between the groups that could have influenced the results here. But now, it's time to bring in one of the villains of the Hair Cafe cinematic universe, Dr. Trash, and that was an email you just heard. So Dr. Trash published a study titled, quote, "Long-term dutasteride therapy in men with benign prostatic hyperplasia alters glucose and lipid profiles and increases severity of erectile dysfunction," unquote. So if you go to any hair loss forum or subreddit, you'll inevitably see some dork who thinks he's smart by posting this Dr. Trash study, but the study is complete crap, or it's complete trash, as I should say. Unlike the studies we've covered so far, it is not even a randomized control trial. It is just an observational study. All the subjects in the study came from one urology clinic in Bremerhaven, Germany. So from just this one urology clinic in Germany, Dr. Trash was able to find 230 men on dutasteride and 230 men on tamsulosin, which, like I already mentioned, is an alpha blocker drug used to treat BPH that's not related to 5-AR inhibitors. So let me state once again, Shooms, that this was not a randomized control trial where men were randomized to get either dutasteride or tamsulosin. These men were on dutasteride or tamsulosin according to the whim of the doctors treating them, and this is a huge problem, as we'll soon see. So these men all had periodic blood work done over a course of 36 to 42 months. The study found that men on dutasteride had increasing blood glucose levels and increasing hemoglobin A1C over time, which is a marker of type 2 diabetes. Unfortunately for Dr. Trash, though, as well as all the other PFS losers who think they cool because they post this study on hair loss subreddits, this study has a major flaw, and that is the fact that the two study groups are not comparable in the slightest. Here's the first table in the study, which shows the baseline characteristics between the two study groups. In a large randomized control trial, the two study groups are almost always very similar because that's what randomization does. When groups are assigned by chance, they tend to be very similar. In this study, though, almost every characteristic in the two groups is statistically different at baseline. That includes age, waist circumference, weight, prostate volume, liver function tests, testosterone levels, blood pressure, hemoglobin, cholesterol levels. Pretty much every baseline parameter is different between the two groups. Since the two groups are so very different even before they started medication, it is completely impossible to ascribe the different results to the different medications. So this is a terrible study, but it's probably not entirely Dr. Trash's fault. You see, the reason these groups turned out so differently is probably because in Germany, where the urology clinic is, tamsulosin is considered the first-line treatment for BPH, while dutasteride is considered a backup treatment. Dutasteride is considered first-line only if the prostate volume is very large. Otherwise, it is usually tamsulosin which is prescribed. So men who are getting dutasteride in a clinic in Germany often will have either failed tamsulosin or have worse prostate disease than the patients on tamsulosin. Men like that may very well just have more chronic diseases in general than men who are candidates for the first-line treatment with tamsulosin, and because of that, it's likely that they have more of a propensity to diabetes to begin with. So these groups are not at all comparable, and therefore this Dr. Trash study is just trash, much like every other trashy Dr. Trash study that's ever been done on 5-AR inhibitors. And it gets even worse than that, Shooms, because next up, we're going to see two completely conflicting large population database studies. The first one is this one here from China. The study looked at 14,185 patients with BPH and divided them into 1,298 patients on 5-AR blockers and the remaining 12,887 not taking 5-AR blockers. Over time, the risk of developing type 2 diabetes was actually lower in the subjects getting finasteride or dutasteride, particularly in subjects less than 65 years old. The study concluded that people using 5-AR inhibitors were at a lower risk for developing type 2 diabetes than those not taking 5-AR inhibitors. So that's actually pretty surprising given the other studies we just reviewed. But then we have another large study that came to opposite conclusions. This study right here. The study looked at large national healthcare databases from the United Kingdom and Taiwan and extracted from these databases subjects who were on dutasteride alone, finasteride alone, or tamsulosin. The study found the opposite of the previous study. In the study, both dutasteride and finasteride were associated with an increased risk of type 2 diabetes. So, like in the TRASH study, one weakness of this kind of study is that since tamsulosin is a first-line drug for BPH, the subjects who are on tamsulosin may not be as sick as men who are given other 5-AR inhibitors like dutasteride. This seems to be a probable explanation, Jones, especially since both finasteride and dutasteride were associated with an increased risk of diabetes in the study. Most likely, anyone who was a candidate for a 5-AR inhibitor already in the study had an increased risk of diabetes to begin with. The other evidence I have showed you already implies that finasteride in particular should not be associated with an increased risk of type 2 diabetes, so it's pretty strange that it would have the same results as dutasteride. And actually, as it turns out, the authors of the study have a lot more humility than Dr. Trash because they are quite honest about the study's flaws and devote over 2 pages of their paper to the possible weaknesses of the study. I won't go over them all here, but one of the major weaknesses is that this is an observational, non-randomized, non-blinded study. The authors also point out that a longer history of obesity might be linked to larger prostates and more chances of being prescribed 5-AR inhibitors. So men getting 5-AR inhibitors might be more at risk for diabetes because larger prostates might be more commonly associated with diabetes. Another possibility is that tamsulosin actually protects against developing type 2 diabetes, and since there is no real control group, that possibility definitely cannot be ruled out. In fact, when the investigators compared men on tamsulosin to men who had had prostate surgery, there was some evidence that tamsulosin decreased the risk of developing diabetes. So, I think all these studies are very flawed and don't give a consistent enough picture to prove that 5-AR blockers cause fatty liver and diabetes. In fact, there is even more research showing that the DHT-lowering effects of 5-AR blockers might actually prevent fatty liver and decrease insulin resistance. That's exactly what this study suggests right here. It's known that women who have polycystic ovarian syndrome have increased androgen levels, and they also get fatty liver and diabetes. So the investigators hypothesized that androgens might actually cause a fatty liver. So this was a mouse study, but what the investigators did was look at the effect of DHT on liver metabolism. What they found was that DHT increased fat creation in the liver. So DHT is yet again a trash hormone that could actually cause fatty liver. On top of that, there is another mouse study that shows that DHT itself actually causes insulin resistance and diabetes. In the study, DHT impaired whole body glucose metabolism and resulted in hepatic insulin resistance, which is what other studies have been claiming 5-AR blockers do. You heard that right, chums. DHT does everything bad that 5-AR blockers are falsely accused of doing. It's DHT that actually causes fatty liver and insulin resistance, not finasteride. On the contrary, it's finasteride that helps protect against those diseases. But maybe you've looked at all the data and are thinking, well, I don't think there's much evidence that finasteride causes fatty liver or diabetes, but I'm still a little bit worried about dutasteride. Well, I'm here to tell you that you shouldn't worry, chums. We actually have prospective randomized control trials of dutasteride that had a lot more than just a few dozen subjects, and these trials specifically looked at liver function tests and the incidence of diabetes in subjects taking dutasteride. Here's a summary of prospective clinical trials containing over 2,000 subjects in each group, and there was no difference in the incidence of abnormal liver function tests or the incidence of elevated blood sugar levels in the dutasteride group versus placebo. The bottom line here is that the large phase 3 randomized control trials of dutasteride found no evidence of increased blood sugar levels whatsoever. In addition, DHT has also been linked to a form of cancer called hepatoma, which is an extremely deadly liver cancer. So, if we go back to one of the first studies I presented in this video, there was a study titled, quote, "Loss of 5-alpha reductase type 1 accelerates the development of hepatic steatosis but protects against hepatocellular carcinoma in male mice," unquote. I didn't mention it before, but now that I brought up the subject of liver cancer, I thought it was important to show you all this. One of the findings of the study was that eliminating the type 1 5-AR isoenzyme in mice reduced the incidence of liver cancer from 20% of mice to 0%. The results from another liver cancer database study also showed a relation between serum androgen and estrogen levels and the risk of liver cancer. The study found that liver cancer was associated with higher levels of DHT and that elevated DHT levels were associated with a 76% increased risk of liver cancer. So, we can now add liver cancer to the growing list of cancers that have been linked to DHT, the trash hormone, which includes stomach cancer, esophageal cancer, skin cancer, and bladder cancer. So DHT doesn't just make you bald, give you acne, and make it harder to pee. No, that's the least of the hormone's problems. The hormone can literally kill you. Yet despite that, there are still DHT simping internet tough guys all over the internet who defend this trash hormone tooth and nail and will simp for it all the time. Absolutely pathetic of them to do that. So, let me go ahead and just summarize all this, chooms. All this data is just another example of people trying to come up with any reason they can to disparage finasteride and dutasteride, even though their safety was well established many years ago. When you already have prospective randomized control trials that followed liver function tests and serum glucose levels that included thousands of subjects, it's very hard to get excited about some study with just 12 subjects. Also, the larger observational studies are incredibly flawed because the patients who receive a 5-AR blocker for treating an enlarged prostate are not equivalent to patients receiving tamsulosin, since 5-AR blockers are generally reserved for patients who either fail tamsulosin or have much larger prostate glands and therefore a lot more health problems. And because of the flaws in the designs of these studies, they all give different contradictory results. In fact, there is actually research showing that DHT itself causes fatty liver and insulin resistance, and since both finasteride and dutasteride greatly lower DHT levels, they should definitely help stop both of these diseases. Also, if that weren't good enough, 5-AR blockers may even lower the risk of liver cancer. So even any theoretical negative effects 5-AR blockers may have on the metabolism of cortisol in the liver is easily offset by the positive effects of lowering this trash hormone DHT. So we are continuing to see more and more scientific research that shows that 5-AR inhibitors have many positive effects on many aspects of longevity. So I don't think anyone should worry about those drugs causing things like fatty liver or insulin resistance. If anything, the research shows that those drugs will help prevent the progression of those diseases. Plus, we get to keep our hair too, which is pretty awesome. So hopefully this will once and for all put to rest all the doubts and fear-mongering on whether finasteride and dutasteride cause fatty liver and insulin resistance. There's no good evidence that they do, but there is plenty of good, strong scientific evidence that DHT does cause those problems. So if you want to reduce your risk of liver disease, diabetes, liver cancer, not to mention keeping your hair, then you'd be a fool not to take finasteride or dutasteride. So thank you all for watching, hair loss switchers. I'll see you all next time. God bless.